Hello again, everybody. Thank you for attending today's meeting where we're going to go over open enrollment and some insurance renewal changes for some of the plans for the district. Today we have Erica Mendoza and Brian Franz from Gallagher, and they're going to come and present to you guys to discuss any of the changes that's happening. If there are any questions in regards to this presentation, Shannon Cusack will be at each of your buildings over the next 2 weeks to answer those questions throughout the day. Erica, Brian, if you want to go ahead and absolutely.
Yes, good afternoon. Can you hear me?
Yes.
Perfect. Good afternoon, everyone. My name is Erica Mendoza, and I am the benefit consultant with Gallagher. I am the consultant for Evergreen Park School District 124, and I'm very happy to be here today. So with me today as my co-host, I have Brian Franz, and so we'll be presenting the presentation together today. So Brian, do you mind sharing your PowerPoint so that we can begin?
I was on mute. Yes, I will. All right, let me know if you can see it.
Yes, I can. Perfect. Well, Evergreen Park School District employees, welcome to the special open enrollment presentation. Brian and I are both very excited to go over the presentation, not only to cover the medical plan changes, but also to remind you of Blue Cross Blue Shield member resources, value-added programs within the cooperative, and just resources that you have available throughout the year. So we'll get started. Just a few housekeeping items. If you go on to the next slide. We will be recording this presentation. This is really meant to be informational session, so we will not be going over or taking questions during this meeting. But Sharon, as Eric mentioned, Sharon Cusack will be at different buildings. We have those dates and times at the end of the presentation. And so she'll be on site to answer any questions. But really wanted to focus on this presentation being informational, an overview of your current plans, highlighting the plan changes, things for you to consider when you're enrolling in a plan or maybe choosing to change a plan. So we really hope that this is helpful in reviewing this information. And then afterwards, we'll also make the presentation available along with some flyers that can help you in your decision making. And with that, we'll get started. All right, so we have a nice full agenda today, but promise we'll make it really interesting and hope that you take away some important items from today. So we're going to go over the special open enrollment. We'll talk about a dependent eligibility audit that's coming up, medical plan changes, medical plan overview, and as well reminders on Blue Cross Blue Shield member resources and value-added programs within the EBC cooperative. All right, so this is your special open enrollment for medical only. And we say medical because we're making plan changes. So that is what's granting us the opportunity to offer the special open enrollment for you to make decisions based on these plan changes and decide which plan it is best for you. The special open enrollment will be held from May 17th to May 31st. And during this period, you can waive coverage if you'd like. You can also enroll in coverage if you waived in the past. You can switch between plan options and you can add or drop dependents. Now, it's important to remember that after the special open enrollment period, you cannot make any changes to your election unless you have a qualifying life event. That could be birth, marriage, divorce, or loss of coverage. There's only 31 days within the event that you have the time period to make that change. Otherwise, you have to wait until the next open enrollment, which for the district is typically in the fall and around November for a 1/1 effective date. Now, these changes that you make during special open enrollment for medical will be effective on July 1st, 2024. All right. So Evergreen Park is part of the Educational Benefit Cooperative, also known as EBC, and the EBC is conducting a dependent eligibility audit. So what is that? That is really making sure that we are covering the right individuals, right? The dependents covered are eligible for the coverage. So it's a review of dependents covered on the plan to ensure that they meet those requirements. So what do you need to do? If you cover dependent, you will receive an email and letter to your home informing you the steps that you need to take to provide documentation. Now, we're going to make this process very easy. You'll be able to provide this documentation either via mobile or website app or website browser. And there will be additional information coming to your home with that information. So there'll be lots of instructions, but this is really more for awareness that this project and this dependent audit is starting on October 1st through November 15th. Can you move to the next slide, Brian?
Yeah, there's a little bit of delay.
Okay, yeah, sorry, there's a delay. So who is eligible? That includes your spouse, your children, whether they be a birth, adopted, stepchildren, children under legal guardianship. And your next question might be, what documents are required? So that would be most recent tax documents showing that you're married, filing jointly or separately, birth certificate, court documents. Now, don't worry, there will be a lot of information that will be coming your way with a list of information of documents that will be accepted. Impact Interactive is the company that's doing this dependent audit. And so they were really going to guide you through the process. In addition, we'll be sharing additional information with the district to communicate with everyone else out here so that you're aware of the process. Now, something to keep in mind is that if you are not able to provide documentation for your dependent, and they're determined to not be eligible, they will be termed off the plan as of January 1st, 2025, and they will not be offered COBRA. With that being said, though, we are working on having a resource available to those dependents who are not able to continue coverage with the district to find alternate coverage plans. So that could be with any carrier. It does not have to be with Blue Cross, but we're planning on having that website live after the dependent audit, or during that process, I should say, so that employees can look at their options and resources for other coverage options. All right. So medical plan changes. I mentioned at the beginning of the presentation that this special open enrollment is being held because of the medical plan changes that the district made. So let's go over that so it's very clear to everyone what those changes are. First, let's look at your HDHP plan, your PPO Plan H. Now, this plan, it's a high deductible health plan, which is why we call it an HDHP. It utilizes a PPO network, so you do have access to the largest network with this plan. And to the left-hand side is your current plan, and to the right-hand side is your new plan, your updated plan. We're still going to continue calling it a Plan H, but we've made the changes noted in red here so that it's easier to see. So you can see that we now have a separate in-network and out-of-network deductible. Now, the majority of members here are utilizing the in-network benefits because you maximize the benefits for yourself. And there's also really a risk of being balance billed when you go out of network. So it means that there's no protection there. You can't actually pay more than these out-of-network amounts. So going forward, we have these breakout of in-network and out-of-network amounts for your deductible and your out-of-pocket. We can see that your individual deductible has gone up to $1,800. The individual plus one is now $3,600, and the family deductible is now $3,800. Your deductible does feed your out-of-pocket, so you get credit for that. And so you can see now that your out-of-pocket limit is $3,600 for individual, $5,600 for individual plus one, and $7,600 for family. Now, before in the past, you can see that you had 100% after deductible. The plan now pays 90% after deductible. So that means that the plan will pay 90% after you meet your deductible, and you as a member will pay 10% up, and that will feed your out-of-pocket until you meet your out-of-pocket limit. Once you meet your out-of-pocket limit, the plan pays at 100%. So this is a different change from what's currently in place, but it really is a standard design for HDHP plans. So this is a change that will be effective 7/1/24. Now we also have your HMO plan. So to the left, again, similar to the previous slide, you have your current HMO plan, and then to the right of that, you have your updated plan. And we've highlighted those changes in red so that it's easier to see. So you can see that the emergency room is now going from $50 to $150. That copay, though, is waived if you're admitted to the hospital. Now we also have the office visits. That's going up from $10, and that was for PCP and your specialist. PCP is your primary care physician. And now on the new updated plan benefit, it's going to be $20 for your PCP and $40 for a specialist visit. Now, we've also made updates to your prescription benefits. So we are still incentivizing you to get the generic medication. So that will remain at $5 for preferred generic, $15 for non-preferred generic, $30 for preferred formulary, $50 for non-preferred formulary, $75 for specialty, and $150 for non-preferred specialty. And mail order, which is 90-day supply, is 2 times. So you're paying 2 months supply, but you're getting 3 months supply. And so this is really a nice benefit for members. Now, something to mention is that if the prescription costs less than $15 for a non-preferred generic, for example, let's say it costs $10, you will be charged a $10 copay. So you won't be charged that cap at $15. It's just limits within the ranges or limits within those categories of medication. So the maximum you'll pay for that medication will be $15 for a non-preferred generic, but let's say it costs $10, you will be charged those $10. Now, your PPO plan E and G, those plans have not had any plan changes, so they remain the same. So what we have here is the current plan design. I know it's a little stretched out here, so it's maybe not as clear, but we are sharing this benefit summary with all of you, so you'll have access to it and you can see the plan design in more detail. But again, no plan changes to this design. Now, I'm sure many of you are wondering, do we get credit for what we've paid for through the year, right? From 1/1 through June 30th, because this is effective 7/1. Now, the good news is that you do get credit. So if you switch from a PPO to an HHP or vice versa, you will receive credit for the amount you paid from January 1st to June 30th. Now, due to the variances in the plans, right, we have a PPO plan E and G, and then we have the plan H. That credit does not automatically follow. So it is a manual process. So in order to do that, when after July 1st, you'll have to contact Blue Cross, which is the number on the back of your ID card, and ask them to provide credit for the amounts you paid from January 1st through June 30th. Now, just be patient because it does take a little bit of time to reflect in your Blue Access for Members account, also called BAM, which we'll go over later on to show you the value of the BAM portal and how to go on there. But you will get credit for that. And if you can't encounter any issues, please let Shannon Cusack know, and she'll provide additional support. She'll work directly with us, and we'll escalate that internally if it's an issue in getting you credit for that. Now, something else to keep in mind is that credit is for the amount you paid, right? So if you are in family coverage now and move into single coverage, you're only going to get credit for the amount that you as an individual paid. So every person that's covered will get credit for what they paid throughout the year if they continue to be covered. Hopefully that makes sense. But if there's any questions, please let Shannon know. We can help answer that. As a reminder, your benefit period is calendar year, so that's January 1st through December 31st. So that just means that it restarts on a January 1st year. And now I'm going to pass it on to Brian.
Thank you, Erica. All right, so let's transition into all of your medical plan options. I understand that a lot of this will be a little repetitive from what Erica just said, but it'd be a nice breakdown to know just so you make the most well-informed decision when going through the special open enrollment. But before we do, I think it's important to consider the following factors to think about while you are considering each of these plans. First is provider availability. Are my providers restricted to a certain network or medical group? Maybe if you're thinking about the HMO, what hospitals near me are in network? Secondly, your costs. What's going to be deducted from each of my paychecks? How much will be deducted in total each year? And then third, your benefit payments, meaning, how much do I have to spend out of pocket before my plan kicks in? What are my co-pays for a particular service? And then fourth, your anticipated medical expenses. Do you have any major medical procedures coming up? All important factors to think about while, deciding one of these plans. So let's begin with the 3 PPO plans available to you. So as we mentioned before, there are 3 PPOs, one of them being PPO Plan H, which is a high deductible health plan. But before we dive into the numbers, and again, I understand that this might be a little repetitive, but wouldn't hurt to hear again. Let's define some of the important insurance terms. So starting at the top of the graphic, let's talk about the deductible. A deductible is the portion you pay initially before the plan kicks in. When the plan kicks in, it will kick in at a certain listed coinsurance percentage. For each of these plans, it's 90 in network, 70% out of network. You will be responsible for 10% until you incur enough claims or a large enough claim to then hit the out-of-pocket max. After that, your plan pays at 100%. Some important things to note for these plans that Erica did not mention yet is that PPO Plan E and G are the traditional PPO plans, which entails that their medical and prescription deductibles are not intertwined, so they do not feed each other. However, PPO Plan H, the high deductible health plan, is different in that the medical and prescription expenses you incur are intertwined. So any qualified expense incurred will feed into one merged deductible, which does differ. And as always, WellCare, which is your annual checkups, are covered at 100% in network. So we always encourage you to take advantage of it to catch things earlier rather than later. All right. So now that we kind of understand the numbers behind your PPO plans, I'd like to zoom out to a more holistic view of how PPOs work. So how does a PPO work? A PPO offers flexibility and it gives you access to a large network of providers, Under the PPO plan, you can pretty much visit any provider you want. You are not required to select a primary care physician, and you do not need referrals. You receive out of coverage if you go in network, or you'll receive coverage if you go in network or out of network. However, you will receive the highest level of benefits if you visit an in-network provider. Another important thing to keep in mind is that if you visit an out-of-network provider, you run the risk of being balance billed, which Erica did mention briefly, which means that the provider can bill you for the amount the insurance did not cover. So in order to get the most benefits from your plan, you are highly encouraged to visit an in-network provider again. All right. So I mentioned earlier, PPO Plan H is a high deductible health plan, and it differs in another key way. Another key difference is the ability to contribute to a health savings account, or commonly referred to as an HSA. So this is an individually owned, portable, tax advantage account that can only be used for eligible medical, dental, and vision expenses. This means that the HSA follows you no matter your employer. You can move out of state, become a completely different job, you would still have access to those funds. All funds remain in your account indefinitely until you use them. If you are enrolling in the high deductible health plan, you may enroll in an HSA, but it will be important that you meet the eligibility requirements outlined in the next slide. So pay attention to those. We will also share a high deductible health plan / HSA guide and FAQ to provide additional information and help guide you in your decision-making process. So keep an eye out for that as well. All right, so who is eligible for a health savings account? So an individual can open and contribute to an HSA if the individual is, one, most importantly, enrolled in a high deductible health plan, which is Plan H again, has no other disqualifying coverage. So what does that mean? What disqualifies you? So that means you have coverage under a health flexible spending account, or FSA, with your employer or your spouse. So if your spouse contributes to an FSA, you're not eligible to contribute to an HSA. That's just one fact, or one reason. Another reason is coverage under a health plan that is a non-high deductible health plan, such as coverage under a spouse's HMO or PPO plan. This is called first dollar coverage, so you cannot have first dollar coverage elsewhere. You cannot have coverage under a health reimbursement arrangement, which is known as an HRA. You cannot be claimed as a dependent on someone else's tax return, and you cannot be enrolled in Medicare. If you are currently enrolled in an FSA, you will need to wait until next year, 2025, to open and contribute to an HSA. So let's talk more about how an HSA works. So an HSA is a bank account that you own and use to pay for current and future qualified healthcare expenses. A huge perk of HSAs is that it has a triple tax advantage, meaning that your contributions go in tax-free, your investments that they accumulate, earnings accumulate tax-free, and then at the time of purchase, your distributions are not charged tax. So contributions can be made pre-tax through salary reductions or after tax and then taken as an above the line deduction. An important thing to keep in mind, though, is that the account holder is responsible for self-education and reporting to the IRS. The HSA trustee or custodian, which is the bank or the HSA vendor you're using to open an account, is not required to determine whether HSA contribution or HSA distributions are used for qualified healthcare expenses, and neither is the district, which is your employer. So now let's transition over to your HMO plan, which is offered through the HMO Illinois network. So we kind of talked about how a PPO plan design works. So let's talk about how an HMO plan design works. And we understand what deductibles, coinsurance, and out-of-pocket limits are now, so this should make a little bit more sense to you. So for most HMOs, there's no deductible to meet. Instead, each medical expense has an associated charge or copay to it. These copays add up to contribute to an out-of-pocket limit. After your out-of-pocket limit is reached, the plan and all other, you'll see here that they all cover it at 100%. You no longer are charged copays for anything after you meet that out-of-pocket limit. So let's discuss a little bit more about the rules that come along with an HMO. So how does an HMO work? So after selecting an HMO, you need to do two important things for you and your dependents. Firstly, you need to select a medical group. Medical groups are basically a sub-network within the HMO Illinois network. They're cooperative of affiliated general care and specialist providers. Medical groups are represented by a 3-digit code. Most members choose a medical group based on their current provider's affiliations or based on how close hospitals or provider offices are to their home. Once you have selected a medical group, the second important thing you need to do is select a primary care physician or PCP within that same medical group. So your PCP is your general care provider and is the only one that can refer you to see specialist providers within the medical group. If you receive care outside of the medical group or without your PCP's referral, your benefits will be denied and you'll be forced to pay out of pocket, minus a few exceptions. For example, if you are admitted to the emergency room, you do not need to worry about receiving care within your medical group or your PCP's referral. However, once you are in the hospital and everything has been situated, you should call your medical group to give them that heads up. So HMOs do offer the flexibility to change your medical group or your PCP. How do you do that? So how do you change your medical group? You can call into the customer service line on the back of your medical ID card, request the change. This change will be effective first day of the following month. So for example, if I were to call in today to try to change my medical group, it would become effective. That change would become effective June 1st. If you were to change your PCP, it's a little different. You need to call into the medical group's individual customer service line, request that change. That change would become effective tomorrow if you were to change it today. You might be wondering how you or a dependent would receive care while away from home, while traveling maybe, or living out of state as an HMO member. So Blue Cross Blue Shield acknowledges these situations and offers the following options for their HMO plans. The Blue Card program offers benefits for non-emergency care while traveling. The guest membership program offers benefits for those that are living outside of their HMO's participating service area longer than 90 days. So a common example of this is dependents maybe attending college out of state or outside of the service area. If you are interested in any of these options, if you think that this could apply to you, please reach out to the district to learn more. We do have more information on that. So now that we've covered all your different plan options and some of the rules that come along with them, a great thing to sign up for if you already haven't is Blue Access for Members. This is Blue Cross Blue Shield's member portal. You can do a ton on this site. So let's talk about that. So this whole list does a great breakdown. So you can check your claims, the claims history, view explanation of benefits. You can request a new ID card. Maybe if you lost it, you can download a digital ID card, maybe print out a temporary ID card. They have a bunch of different features, a few of them being Provider Finder, which is that search engine, which we'll talk a little bit more later on. Search engine where you can find providers based on a wide range of different search criteria. You can go on their wellness portal, Well on Target, which we also will talk later, and more. So let's dive into a little bit more on.
And just a comment, this is also where you can see your credit for your deductible out of pocket once you've requested that. So this is a really good place for you to see where you are, where deductible and out of pocket if you're on the PPO and HDH or HDHP plan.
Yeah, that's a great point. Here's how you can sign up for Blue Access for Members. It's really easy. You go to bcbsil.com, click register now. You can use the identification number on the front of your ID card to sign up, or you can call the customer service number and those reps could help you out. So as mentioned previously, this is Provider Finder, which is great for, especially deciding between plans. Maybe you want to figure out if your current provider is in network, what medical group they're a part of. You can search by more than that. You can search by zip code, gender, specialty, languages. They have ratings on them. So a wide range of different tools to be able to find a provider that works for you. All right, so let's shift now into the Blue Cross Blue Shield value-added programs available to all members enrolled on the medical plan. So that's your HMO, PPO, and high deductible health plan members. Beginning with Well on Target. So Well on Target is that wellness portal I was talking about. Here you can view, exercises, recipes, progress trackers. They have all these different features. We'll talk about Blue Points a little bit later, where you can redeem merchandise for completing certain challenges. It really has everything that encourages a healthy lifestyle. So check that out if you are interested. Now let's talk about the fitness program. So the fitness program offers a wide range of different size networks of gyms. So these are your LA Fitnesses, your exports, all those common gyms that pop up all around where you live. They're part of these huge networks of gyms. You can enroll based on the size. You'll see there's digital only, base, core, power, elite. They get bigger as the monthly fee goes up. There is an enrollment fee some months, sometimes it's waived. But this fitness program offers that flexibility. Maybe you'd like to go to a gym near your work during the weekday and then a different gym over the weekend. So it's great, and it's very moderately priced. I know from personal account that I spend a decent amount on my membership. So the fact that you're given, 3,000 gyms maybe through the base program at $19 a month really is something to think about. All right, let's talk about Blue Points program, which I recently mentioned. So Blue Points program is integrated into your Well on Target, as well as, fitness program. It really is integrated into a lot of different things within the Blue Cross portal. For example, on Well on Target, if you were to track your progress or complete a challenge, you would get Blue Points, which you could view on Well on Target. It would accumulate in that top right-hand side of your screen. With these Blue Points, you can redeem them for merchandise. You see the pictures here. It could be a bicycle, it could be a purse, could be an Apple Watch, AirPods, a lot of different merchandise. So something to take advantage of, and really incentivizes you to, focus on your health and establish healthy habits. All right. So the Blue 365 member discount program, you can sign up for free as a member. This would be like a weekly email about, what you get 20% off maybe for the week. It really revolves around health and wellness, products. So again, your AirPods, your Apple Watches, maybe like fitness clothes, a bunch of different stuff. So
They sometimes even have, just to add to that, Brian, they sometimes even have like nutrition. If you want to order like pre-made food, they have discounts through different partners with that. So I get the emails, and they're pretty good. They're interesting offers, and I've utilized them before.
yeah. So we just covered the Blue Cross Blue Shield programs available to everyone enrolled in the medical. Blue Cross offers actually a few more programs to PPO and hydro health plan members specifically. So let's talk about that now. Beginning with Learn to Live, which is the digital mental health, program. It's there for you for stress, anxiety, worry, depression, social anxiety, insomnia, panic, substance use, resiliency, a whole lot of different, fields to address your mental health concerns. I downloaded it myself. You log in, you register and log in. And it asks you all these sorts of questions, narrows down, what could be, the root issue of it all, and then has programs specifically addressing those issues. So great to take advantage of. The 24/7 nurse line is also available to PPO and high-deductible health plan members. It is what it is. It's a 24/7 nurse line. It's on the back of your ID card. It's a separate number, and you can speak to a registered nurse whenever. So any type of medical question you have, maybe you need advice, you don't know where to go, this is a great first step for you. All right, now let's transition over to diabetes management. Now recently acquired by Teladoc Health. If you were familiar with the program before, prior to this year, it was Livongo. It's now Teladoc Health, but the functionality of it did not change. So if you do receive a diagnosis of diabetes, you will be given outreach individually. You won't need to reach out yourself. if you do feel you do qualify for this program, please reach out to the district and we'll address it individually. But so you get that diabetes diagnosis, you'll be mailed, testing strips, lancets, glucose monitoring, everything you need to, get those results sent out to your doctor, sent out to clinicians within the Teladoc Health site, and you'll receive all the different lessons and coaching to address diabetes management. Similarly, they offer a program for hypertension. So if you're given a blood pressure reading at that threshold that meets the diagnosis, you'll also receive this automatically. If you opt in, you'll be mailed that blood pressure monitoring device. The online coaching, the lessons is all there for you as well. Coaching in nutrition, weight stress, blood pressure management. All through Teladoc Health. So reach out to the district if you feel you do qualify and haven't gotten any outreach yet.
And just to add to this, I think Brian mentioned already, but just to reinforce it, these programs are both free. They're paid as preventive services, so there's no out-of-pocket cost for you to participate. You can choose to utilize all the services, including the reporting feature, but none of it comes at a cost to you.
All right. Yeah, thanks for adding that. Now let's move on to the benefits value advisor. So what can a benefit value advisor do for PPO and high deductible health plan members? So they really are that 24/7 concierge service. They're more than just that customer service team. They can help you find a doctor, facility, get cost estimates for procedures and services. They can schedule appointments for you, set up prior authorizations. They really are there for you 24/7. They are that customer service line that's listed on the back of PPO and high deductible health plan members' cards. So, they can do a lot for you.
Yeah, and this is just as a reminder, this is the number that you would call when you request credit for your deductible and your out-of-pocket amount. So they would be able to help you with that and guide you through the process and complete that manual carryover of deductible and out-of-pocket amounts.
Mm-hmm. So let's transition over to member rewards program. So this incentivizes you to shop around for certain services. Let's say you get your general care doctor told you need a colonoscopy. So, you get that, procedure recommendation. You can search around specifically on Provider Finder or through calling in the customer service line, that BVA. And, they could help you find different locations, and each location has an associated price to, our example, the colonoscopy. So if you were to opt into a more cost-effective procedure, maybe, Blue Cross Blue Shield will reward you with a check in the mail for reimbursement of that service. So something to think about, saves you money and saves the plan money. So this is a slide kind of how member rewards work. I might have already addressed some of it. So yeah, again, you can call into your BVA, that customer service line, or you can search online via Provider Finder. So the benefits value advisor is pretty self-explanatory, but through Provider Finder, you can look up, find care, look up the certain procedure, colonoscopy. It would bring down an entire list of the different locations that offer it near you, and give you a rough cost estimate of what that would cost, as well as there's a little green graphic with the amount that's you're eligible for in reimbursement. So if you were to just schedule any colonoscopy, you wouldn't be eligible for this reward. You have to actually make the effort, whether that's through the BVA or through Provider Finder, to be eligible for that reimbursement. All right, so that wraps up the Blue Cross Blue Shield value-added programs, but now let's talk about the EBC value-added programs. Again, Evergreen is part of this EBC, and with that comes some of these exciting programs. Beginning with Wonder, which is a digital weight loss management program available to both HMO and PPO members. It kind of has a unique approach to weight loss in the way that it doesn't, tell you what exercises to do or tell you really what to eat. It makes you more think about how you're eating and when you're eating and why you're eating. Am I hungry, or do I just need to drink a little bit of water, stand up? How am I eating? Like, should I, when I'm eating popcorn, for example, maybe I should eat it kernel by kernel rather than a whole handful. And that would, allows your brain and your stomach to kind of process the food that it's intaking, makes you a little less hungry if you were to take your time. So that's just a few examples. With this, there's lessons, there's coaches, all about, how to eat rather than what to eat. All right, now let's talk about Teladoc, which I'm sure a lot of you are familiar with. This is the telemedicine service available to you for PPO members, for PPO and HMO members, excuse me. It's no cost to you. For high deductible health plan members, which is that PPO plan H, there's a $53 copay per session. This is a great program to utilize in non-emergency urgent care situations. So that's your ear infections, UTI infections, any type of thing that requires a prescription to be written out. Maybe you need an antibiotic written out as soon as possible, and you don't want to wait for your general care to schedule an appointment with your general care provider. With Teladoc, if you were to not schedule an appointment, the average wait time is 10 to 20 minutes, so it really is quick. And then obviously you can schedule an appointment yourself, and that would be almost instantaneous when you join on. So this is at no cost to you for PPO HMO members. Again, $53 copay for high deductible health plan members, but regardless offers great savings to you, because that that office visit that you could go in is a lot more than what you could be paying for Teladoc, which is nearly nothing if you are that PPO or HMO member.
Yeah, and just add a quick note on the HHP. You're probably wondering, why do I have to pay a copay but not on the PPO and HMO? And that's just we talked about it early in the slides. But first dollar coverage. This is an IRS rule with HDHP plans that does not allow you to have coverage without meeting the deductible. So that $53 will feed that amount. But it's really still a more affordable option than having to pay a doctor's visit that could cost $200. So just something to keep.
Yeah. All right, so let's talk about the Employee Assistance Program. This is mainly known for the five mental health sessions per incident. In addition to the mental health services, they offer bereavement, legal, and financial services. They have in-house referrals, out-of-house referrals. It really is a program to take advantage of when you don't know where to go, whether that's with your mental health or whether that's with your finances, or maybe there's a legal matter you need to address. This is great just to talk to someone. They know, they're the experts. They know what they're doing. They'll get you the help you need. All right. So the 24-hour travel assistance program is literally what it sounds like. So when you're traveling more than 100 miles away from home, you can call this toll-free number, the U.S. toll-free number, or a worldwide number if you are outside of the U.S. And they can address a wide range of traveling issues, whether that's you lost your passport maybe, or you broke your leg, maybe there's a natural disaster in inbound. They do help with pre-trip assistance too, whether that's your, what vaccines you may need going to a certain country, helping you, retrieve your passport, a wide range of options that are available to you. So store that number in your phone, or maybe print it out for your next vacation, because you never know what could happen. All right, let's talk about InfoArmor now, which is an identity protection service. So it's kind of a two-branch or two-part program. So they have Wallet Armor, which you'll see on the left-hand side. So that's where you store sensitive information like your user IDs, your passwords, your ATM, credit cards, checking accounts, Social Security maybe. That's an encrypted, site would store it, is there for you for your reference in case if you forget. And then with that, they offer recovery services. So if any of that information were to get leaked, maybe your identity gets leaked, they then offer advocates that work on your behalf to recover that and prevent any further damage. So something to keep in mind. Complete no cost to you. All right. And last but not least is Navigate, which is the EBC Wellbeing Portal. So here, again, you have access to all these programs we mentioned, quick links to them. In addition to that, there's recipes. A few you might have participated in the EBC Wellbeing Challenges this year. There's Reach for It. I can't think of the other names, but there are challenges there for you. There are exercises. Again, it's that wellness portal, so it's there to instill some healthy habits for you and serve as that one-stop shop for all the programs we talked about today. So you can actually register for an account. Visit ebcwellbeing.com, click join now. It'll verify your information, make sure you're that EBC employee, and then you can get started. All right. So I understand that this was a lot of information to kind of digest at once. Again, this presentation serves more as informative. But if you do have any questions, Shannon provided us locations and dates and times to ask them. So you'll see here. I'm not sure exactly what Northeast means. I'm sure that's a location that you're familiar with. But visit those sites. Shannon will get you the help you need, answer your questions. And yeah, that just about wraps up our presentation. We appreciate you listening in. Again, reach out to Shannon if you do have any questions. We'd be happy to help Shannon in any way. So thank you.
Yes, thank you for joining the meeting. We hope this was helpful. And again, follow-up presentation and attachments will be shared with everyone. And please reach out to Shannon. And we'll work.
Eric, I think your connection's giving out on you. Are you experiencing the
Have a good
same,
day.
Eric?
Yeah, thanks again, everybody. I appreciate it. I appreciate coming to the meeting. If anyone has any questions, please feel free to reach out. Thank you for your time. And this will be posted on YouTube by the end of tomorrow, I believe. And if anyone has questions, feel free to reach out. Thank you.
Thank you.
Thank you again.